Welcome back, it's Dr. Somji.
As Dr. Solomon here.
Today we're going to be talking about a condition that we both see a lot in clinic that people don't even know that they've had, and is probably responsible for probably about 80% of their skin concerns, and they struggle with product after product, treatment after treatment, that they're undiagnosed. That diagnosis is rosacea.
So rosacea is something we've come across from our medical school days, in fact from our childhood school days. Of course we didn't know what it was at those days, but medical school days, our junior doctor days, every specialty we've worked in, and during our training days we have come across rosacea. So what is it? What is rosacea?
Well, rosacea, if you're simply talking about what it is the presence of superficial blood vessels much higher up in the skin than they should be. And because of that, it creates a lot of problems. And also the prominence of too many blood vessels within that area as well. And that's what I would say to a layperson of what rosacea is. So we can see it. You look at people like, for example, Alex Ferguson, big red cheeks, and people always used to associate that with drinking too much wine.
Or anger.
Yeah, or anger. But actually, anything that opens up blood vessels would make someone's rosacea worse. And that's an example of what we call type 1 rosacea, which is the presence of vascular rosacea, so i.e. those blood vessels that are sitting more superficially in the skin. And you see them as thread veins, you see them as superficial redness. When patients drink alcohol that opens up blood vessels, that redness gets a lot worse. If you're outside and it's cold and you walk into a warm environment, suddenly you flush. So typically with type 1 rosacea, you see the presence of thread veins, the presence of flushing, and that sort of reddish hue that you notice with everything. So that's type 1.
So you talk about type 1, there are actually 4 types, aren't there?
Absolutely, yeah. So
tell me about the other 3 types.
Okay. So type 2 is probably the most controversial type of rosacea because it used to be termed acne rosacea, and it's called now, as you know, Papulopustular rosacea. Basically that means that you see these little spots that almost mimic acne, and this is the one that gets everyone because they do traditional acne treatments and it doesn't work, and they think it's spots, and it definitely looks like a spot, but actually it's type 2 rosacea. And that's because, again, the blood vessels sit superficially in the skin, therefore you lose a lot more moisture and hydration, especially if you damage the skin barrier. And then what happens is that you produce more sebum on the surface of the skin, acne bacteria decide to multiply, and therefore you get spots. That's the mechanism that you get with type 2 rosacea. And then imagine if you do traditional acne treatments, which are drying, stripping, exfoliating,
Make it worse.
You're going to make it worse. So these are, and if you think about it, in the UK, probably around 35% of the Caucasian population have rosacea that is undiagnosed, and they have acne, and they think that it's acne, but it's not, it's rosacea. And then you have to treat it completely differently, and you actually have to supplement that skin barrier. So things like, you know, kind of ceramides, cautiously, nice kind of fatty acids, and even supplementing with omega-3 acids as well. So your diet will help repair that barrier. So type 2 rosacea is one of the things that if you don't see a proper skin specialist or someone that knows what they're doing to treat your acne beforehand, and they don't rule that out, you could get into a real problem.
Okay, and tell me about type 3 then.
So type 3 is one that we all know and love. We mentioned Alex Ferguson, so that big, large, thickened nose, it's called rhinophyma. Build up of that excess skin. So imagine you've got too much blood supply, you're losing a lot more volume, and therefore you produce a lot more sebum in the nasal area.
So the skin thickens.
Skin thickens, you actually get layer upon layer of skin, and actually the nose becomes larger. And we treat that in a number of different ways, right? So CO2 laser is one of the biggest ones, where we literally just ablate the skin off, so peeling layers of skin and revealing essentially the nose that you had. And rhinophyma is one of the most satisfying things to treat.
It is. In fact, we all had a school teacher or a relative at some point that we remember that just had this bulbous nose, and I always used to wonder what that was. Now looking back at it, in fact, it was rosacea, it was type 3 rosacea. So tell me about type 4.
So type 4 is ocular rosacea, so the presence of superficial blood vessels in the conjunctiva. You can normally see that, and it can sometimes actually be quite symptomatic. It's very rare. I mean, how often have you come across that?
Very rarely, but in fact, I do see type 1s mixed with type 4s, type 2s mixed with type 3s. So that's the important point. Yes, on its own, type 4 is quite
Type
rare.
1 and type 2 tend to be together. I normally see that. And then you've sometimes got sort of type 4 just by themselves with type 1 is a common combination. But if you're thinking about it logically and you want to know how to treat this, you want to be building your skin barrier, so superficially. So things like ceramides, fatty acids, anything that supplements the skin barrier is going to be great. You can see our other videos on talking about skin barriers and other brands that can help supplement the skin barrier, particularly CeraVe, are great for people with rosacea. With type 1, you've got those open blood vessels, those thread veins. So things like lasers are fantastic, so laser-based light. So things like DIVL laser, vascular lesion lasers, IPLs are great for this, and they are something that you would have to maintain because rosacea is a chronic condition for life. Also, radiofrequency thread vein removal, given you do a lot of that. You pick off superficial veins and coagulate with radiofrequency, works very well too. And then also you move into type 2 rosacea and you say to yourself, well, okay, fine, there's some medication that can help. So Soolantra, which is a medication that can be prescribed topically, can constrict blood vessels. So great for type 1 and then eventually for type 2. So it will stop that process where you lose the moisture. Soolantra works really well for probably around 30 to 40% of patients. Works averagely for about 30 to 40, and then doesn't work at all for that remaining sort of 20%. But it's definitely worth asking your physician to prescribe that.
In fact, yeah, it is a prescription drug. Soolantra is actually ivermectin. Ivermectin is a parasitic drug, an anti-parasitic drug, and in fact, quite popular recently because of the pandemic. And we won't mention the C word for the sake of the YouTube algorithm. But in fact, it was, and it's still used as one of the drugs to treat the virus.
The virus.
Yeah.
So, but no, look, at the end of the day, you want to constrict that blood vessel. Other things topically you can put in the skin, like MSM, is sulfur based. It's fantastic for reducing blood vessels and that flushing that you get with rosacea. We do some chemical pills with mandelic acid in the clinic, and that helps with the type 2 rosacea to calm down the skin, reduce the vascularity. As soon as you reduce that vascularity, the acne over the top gets better. And once you've repaired that skin barrier, then you're really getting somewhere with both type 1 and type 2 rosacea.
So that's treating the rosacea. We know there are 4 types. What about preventing it?
Well, I think that definitely your diet is key. So high in omega-3, omega fatty acids is really, really important to help supplement your skin barrier. That's one thing. Avoiding exfoliating and too much resurfacing in clinic. So avoiding things like microneedling if you've got open blood vessels. Microneedling is bad without any coagulation. And no aggressive exfoliation. You don't want to be doing things like dermabrasion either, and scrubbing your skin at home. These are all really bad things that you don't want to be doing.
So who is prone to rosacea? Where do you normally see it on, and who do you normally see it?
Well, you normally see it on fairer skin types. So we talk about sort of that Nordic population is very, very common, especially in the UK in certain individuals. But guess what? I have rosacea. So obviously I'm an Asian skin type, but somewhere in my genetics is something. And I flush. My skin gets very red. I mean, you've always been surprised in summertime when they come up with red cheeks, and even with certain treatments. So you have to be careful, and you have to be able to diagnose it. And people say, oh, I don't have rosacea, I just have redness in my skin.
Indeed,
You have rosacea.
It affects all ethnicities, all skin types. I grew up in West Africa, in fact, and we saw rosacea there. It was actually quite common. Yes, you have a greater percentage in a population of Nordic and Celtic origin, but rosacea spans all ethnicities all over the world. It tends to affect more middle-aged to older age populations.
Because your skin gets weaker, so you lose that collagen and elastin on the surface, and if the blood vessels sitting superficially, suddenly it becomes more superficial, and that's why it gets worse with it.
So in fact, it was always there, but it's just more visible now. And you may have had symptoms when you were younger, but those symptoms are now visible. You can actually see the signs of
And
the
sometimes
rosacea.
for flares, you need low-dose antibiotics. So the tetracyclines are really used for it. So things like minocycline and lamicycline can be used. for long-term or let's say suppression of rosacea, but you really only want to be using that as a get-out-of-jail free card and actually treating it from within. You know, I'm kind of antimicrobial, so you know we don't want to be giving antibiotics unnecessarily, but even though it's low dose, there's still a place for that. You know, and I've seen it help a lot of patients.
So in summary,
there's 4 different types of rosacea. We've listed the treatments that you can get done, as well as types of ingredients to look for in your skincare as well. We're going to do another video looking at top products for rosacea in the high street, so stay tuned, click like and subscribe, and just wait for that video to come out.